Hello, everyone. I am Rae Cho from Seoul National University, and this is Professor Hyub, the corresponding author of this study. We are very excited to share our recent research, the SPY-PASS-2 study, published in Gastrointestinal Endoscopy. This research addresses a major challenge in managing biliary strictures after living donor liver transplantation. Professor Lee, could you explain why this study is important?
Hello everyone, I am Sang-Hyun Lee. I can explain the importance of this study. Anastomotic biliary strictures are common complications after living donor liver transplantation, occurring up to 30% of patients. Anastomotic biliary strictures in living donor liver transplanted recipients are often tight and twisted, making endoscopic treatment difficult or unsuccessful. While ERCP is the standard initial approach, it has a limitation in success rate. That's why we investigate the usefulness of digital single-operator cholangioscopy-guided ERCP with the spyglass DS2 system to overcome difficulties and improve success rate.
Thank you, Professor Lee. To provide some background for our leaders, could you briefly explain what single operator cholangioscopy is and how it's different from standard ERCP?
Absolutely, SOC allows the direct visualization of the bile duct, enabling us to better identify intraductal regions with high resolution images. Also, it can facilitate precise guide wire placement. This is especially useful when standard ERCP fails due to severe stricture. Unlike standard ERCP, which relies on fluoroscopic imaging, SOC provides real-time images of intraductal strictures at the stricture site, enabling more accurate treatment.
Yeah, we are now watching a video clip showing the process of using spyglass to cross the strictures and place the guide wire. And in this video clip, we can see the stricture site introductory structure with a high resolution image. And we can find the small orifice in the right side of the image. And it is really impressive how the tiniest opening is identified and the guide wire is placed so precisely. Now, could you walk us through the study populations?
Sure, this prospective study involved the 40 living donor liver transplantation patients with the difficult biliary strictures between October 2021 and May 2023. We included the patient who had failed standard ERCP attempts, defined as a guide wire placement taking over 10 minutes. We then used the SOC to assist with the guide wire passage and subsequent treatment like balloon dilatation or stent placement.
The results were very remarkable. Let me highlight a few. The technical success rate for guide wire placement was 92.5%, and clinical success, meaning symptom relief or no new developed symptoms within a month, was achieved in over 80% of cases. Complication rates were low and severity was also mild.
That's correct, Dr. Joe. Importantly, our study showed the SOC is effective and safe. There was no cases of bowel perforation, and the observed adverse events were manageable. This makes the SOC is a promising option for anastomotic biliary patient management, especially when ERCP is difficult and ERCP is unsuccessful.
Yeah, absolutely. Another strength of this study was comparing it with the historical data of our institution. SOC performed significantly better than ERCP in similar cases. For example, in triangular type strictures, which are most common and difficult, SOC achieved nearly a 95% of technical success rate compared to 80% with ERCP.
That's a very important point. This study shows SOC has a potential to change the treatment protocols for biliary, difficult biliary strictures, not only in living donor liver transplantation, but also in other complex cases.
Professor Lee, are there any limitations of this study our leaders keep in mind?
Yes, since this study was a single center study with a relatively small sample size, the findings needed to be confirmed through multi-center trials. Also, we focus on initial anastomotic biliary stricture treatment and exclude the patient with recurrent stricture or altered anatomy. Future studies should address these areas.
Yeah, those are very good points. Before we finish, let's discuss the broader impact of this study. Professor Lee, how do you see SOG shaping the future of liver transplantation?
I believe SOC is a big step forward by improving success rate and reducing the need of invasive procedure like percutaneous drainage or surgery. It enhances patient outcomes or lowers the burden of healthcare systems. With further achievement, SOC could become a standard treatment of biliary stricture management in liver transplantation.
Thank you, Professor Lee. This has been a wonderful experience, and I hope this study inspires more innovation and collaboration in the field. Thank you for your valuable insight today.